Hi, I'm Roz, and I'm a perinatal and infant psychiatrist.
What is a perinatal and infant psychiatrist?
This is a specialty area in child and adolescent psychiatry. So this might involve seeing pregnant parents and parents who are struggling with that transition to becoming a parent or having pre-existing mental health problems that are causing distress during this time of life, to prevent the flow-on effect to their parenting or their parenting capacity and ensure they are the best parents they can possibly be. Or it might involve seeing very young children. And you might ask, well, why would young children need to see a psychiatrist? Well, we know from a lot of research now over many years that these early years are critical in terms of what happens later in life, not just in childhood but in adulthood. And this also may impact on parents, their developing relationship with their newborn, and we know this relationship is extremely important in influencing what we call the attachment relationship, and later in life, mental health and physical health problems.
What can I expect if I see a perinatal and infant psychiatrist?
A pregnant parent or postnatally who's coming to see someone like myself, they can expect that someone like myself would do their best to create a welcoming and safe space for them to talk, to validate their experience, to not be judgmental about them struggling because they're doing their best. And then I would be asking a series of questions to try and understand the parent's experience and particularly what this transition has been like for them, how they're feeling towards their baby, how they're experiencing being a parent, and noticing when things are going well, not just when they're having troubles. Often parents are very tired and often very overwhelmed, so it is hard for them to observe and see when things are going right rather than when things are going wrong. Of course, I would be asking questions about their own emotional well-being, their sleep, their appetite, how well they're taking care of themselves, how much support they have around them, because that's really critical in terms of making this transition to becoming parents, and it's often forgotten in the hustle and bustle and all the changes that are occurring. My aim is to try and reach a shared understanding or an explanation with parents about why they might be feeling the way they are or behaving the way they are or thinking certain thoughts which are distressing or unpleasant, so that we can start to then move forward.
What is infant mental health?
In terms of infant mental health, it might be that, parents are asking for help with their baby who's difficult to settle or may have feeding problems of their capacity to regulate their emotions, and there might be struggles and push-pull kind of experiences for parents in just the day-to-day care of their baby, which they can't quite understand, or they've tried many strategies to remedy and it hasn't worked. So as an infant mental health specialist, my task is to bring the infant's experiences into this and wonder about them with the parents. They are hardwired to relate and communicate with their parents from birth to ensure there's not that just their survival, but their growth, development and emotional security.
How do I access a perinatal and infant psychiatrist?
So a perinatal and infant psychiatrist works with a range of other health professionals, including maternity staff, obstetricians, mental health nurses, community mental health staff, including psychologists, child and family health nurses and so on. We might be referred, a parent and an infant or a family, if those professionals felt like a more specialised assessment is required.
How can I get the most out of my visit to a perinatal and infant psychiatrist?
What someone could think about, firstly, is the reason why they're coming to see a perinatal and infant psychiatrist, and to be, if they're not sure, to ask that question again when they see me. It might be helpful for them to bring any records or reports with them from previous assessments, say if they've been seeing a psychologist or if they have pertinent medical history in particular.
A final word.
One thing I always want parents to know, and to know that I know, is that they always want to be the best parent they can for their young child. They always want the best for their infant. Even if it seems like that's not going to happen at the present time, or their intentions or their commitment is clouded by self-judgment or overwhelming circumstances, that's what I always want them to know, that I know.